Somewhere around 10 minutes, and not a million points, maybe 3 that really grind on you and affect your ability to provide good health care to the community.
Bill, thank you very much. I'd like to thank all the sponsors of this. I think the format is excellent, because I think the last thing any of us want to do is try to dissect and talk about HR 3200. I'll try to keep my comments to 10 minutes. As Bill's alluded to, I got a lot of things I could probably say about some of the pitfalls in healthcare right now. But I will limit it to three areas: Medicare, Medicaid, and medical education. To begin with Medicare, I think the problem right now, the biggest problem with Medicare, from the government's perspective, is that the costs are unsustainable. There's a lot of information out there right now on when Medicare is going to go broke. You can kind of pick whichever one you'd like to choose, but the government certainly considers the cost of the program unsustainable in the current time. From the provider's perspective, we think Medicare also is unsustainable because providers simply cannot live off what Medicare chooses to reimburse us. And I think the reason why you have this clash where it costs too much from the government's perspective, we get too little, is because it's overregulated. 11 years ago, I had the distinction and the honor of speaking at the Agency of the Aging Conference in Washington, D.C. And the speaker before me brought along with her a pile of papers about this high and filled it up. She pointed out that 11 years ago, the Medicare program had over 50,000 pages of rules and regulations. And at that time, that was more than the tax code. I seriously doubt if things have changed much since then. But the open regulation is really a fruitless attempt to try to ratchet down the cost of Medicare. And that's the primary problem with Medicare right now. Medicare pays providers for what they do. The tests they do, the procedures they perform. So they start paying for things when somebody's actually way too sick, and when it's most costly for them to be taken care of. The solution to this that I see, this is I'm not sure this will be very well received by Washington, is really to scrap the entire Medicare program as we know it right now, as using it to pay for procedures and things that are done, and instead change to something that's called value-based purchasing. And I could talk a long time about that, but value-based purchasing, in essence, is paying providers to keep people well. You know, what a novel concept, actually paying us to do what we're supposed to do. And you do that by hitting certain quality standards and by hitting certain cost standards. The second thing I would recommend is to establish medical homes for patients. And what I mean by a medical home is that patients should be assigned to family practice physicians like Dr. Meeker and let them guide their care through this entire system. My third point would be to protect doctors like Dr. Meeker, the providers of these medical homes, by some measure of tort reform liability. Right now, doctors, and I think perhaps Dr. Meeker can comment on this also, but they do have to practice a certain measure of defensive medicine. And in order to do that, oftentimes referrals have to be made to expensive specialists and expensive tests, when really it should be in the hands of a person with his education, his experience, and his instincts, who could very well take care of somebody just as well as having the available of specialists to guide them. And the last thing I'd recommend is that if we do change the system we have, it's only trial in just a few states. We're going to change the system we have. Don't dump it in the entire nation. Try it in a few states, see if it works, and then take an approach like that, where we incrementally bring change to the nation. Regarding Medicaid, the state essentially has the same problems that the federal government does. The cost of the program is certainly unsustainable to the state. Yet any nursing home, home health agency, or anyone that relies on Medicaid reimbursement will tell you that if you have more than 50% of your patients paid by Medicaid, you will eventually go broke. The second problem I see with the Medicaid system is that the behavioral health system we have right now is just a mess in the state of Iowa. There are really fewer and fewer places to go for people that have behavioral health problems. Fewer places in the middle of the night when someone comes in and they're exhibiting problems like that for Dr. Meekers and those patients too. The solutions I would suggest, and I've told our legislators about, is the idea of, like in education, implement some type of an allowable growth formula. That being, what that means is that each year, like in education, there will be a cost of living increase to the Medicaid program. We never want to see another time like we had in the early part of this decade, where providers went for a 5-year period of time with absolutely zero growth when it comes to paying for Medicaid. I'd also recommend the same value-based purchasing reimbursement scenario that I talked about for the federal government through Medicare. The last point I'd like to make about the solution that I see regarding Medicaid is that, and this is once again in the realm of behavioral health, currently there's 83 counties in the state of Iowa that are designated as mental health professional shortage areas. And we really do need to expand and reimburse telemedicine for behavioral health. And right now in the state of Iowa, telemedicine, and what I mean by telemedicine is that the patient is on a camera, on TV, and the doctor is at another remote location, be it Cedar Rapids, Iowa City, or wherever that doctor may be. That would significantly reduce the burden on, or the lack of psychiatrists that we have in the state right now to provide these services, if the state would reimburse for telemedicine services. My third point is in regards to medical education. I just heard the other day on the radio, perhaps you did too as a WMT, that there's a survey recently done of family practice physicians. And currently 3 out of 10 family practice doctors, when they had to do over again, wouldn't go into medicine. And there's 3 reasons why they wouldn't do that. The paperwork, low pay, and the fact that they have to practice defensive medicine. Also, doctors, and we actually have some anecdotal evidence of this, are currently being dissuaded in some of the medical schools from going into family practice. In other words, coming to a town like Vinton and practicing medicine because of the reasons I gave above, but primarily because of low pay. I think it's really a shame that young, smart folks go to college, they want to become doctors with the idea of coming back to their hometown and practicing medicine, but they're actually being talked out of it and being encouraged to go into specialties. Because of the pay situation and because of the current philosophy and training of doctors. And my solutions for that, once again, in order to not have doctors fear and have to practice defensive medicine is tort reform, medical homes, throw out the 50,000 pages of Medicare rules and regulations, and enact a new system based on patient outcomes. And lastly, establish a rural track in the state for residency programs. In other words, the University of Iowa, and I just had a meeting this afternoon about this with a representative from the university, and we're imploring them to include in their strategic plan for the coming year the establishment of rural tracks for young doctors so that they can actually learn and embrace rural medicine, like Dr. Riege and the other providers we have in town have. I think that just about exhausts my 10 minutes.
Yeah.
No, you're good. I guess